Hi, I'm Bill Reiner in child psychiatry and pediatric urology. I've been seeing and treating kids and kids with exstrophy for the last, 40 plus years. We've talked about navigating relationships before and some of the difficulties that kids in general have, but especially kids with exstrophy who tend to have feelings and emotions that are really more intense than the typical run-of-the-mill kid, whatever that means. I'm not sure what that means. But at any rate, navigating relationships in general for kids with exstrophy in terms of adults. So when I talk about adults, I mean the adults that kids with exstrophy generally have to navigate relationships with and around is going to be navigating relationships with teachers and adults that are related to either the school life or church life or neighborhood life, their friends. And also, probably one that's uppermost in the minds of a lot of the kids and some of the adults is going to be the relationships with the doctors and nurses that they encounter. Really, we can put all of those together in some respects because the relationships with adults in general and the relationships with teachers is going to be less intimate and less involved, but nevertheless important. The relationship aspects with teachers is going to revolve around the aspects of incontinence most likely and school absences from surgeries or procedures or other issues that occur in children with exstrophy in particular, or children with chronic conditions in particular as well. And those have to be dealt with in a way that the child's privacy is respected. As we've talked about before, privacy is very important to the large majority of kids with exstrophy, and privacy is not secrecy. It's very important that the parents understand, but more to the point that the children with exstrophy understand that there doesn't have to be any secrecy about their having exstrophy. The aspects of exstrophy that they may fear are discovered may be embarrassing. They may even have shame issues about some of those aspects, such as incontinence or the need to wear pads or even diapers or something to cover up the incontinence. But they really don't need to be shameful. They may be anyway, but they don't need to be rationally. And it's important that the children therefore realize that if other kids or parents find out about their incontinence, it isn't going to be the end of the world. It's not going to be a catastrophe, although the kids may think that initially, but it may be embarrassing. So these are privacy issues that need to be dealt with the teachers. And to be honest, I think the more adults who know a lot about what the kids are going through, the greater the chance that that privacy is going to be broken. So it's probably a good idea to keep the number of adults who are in the loop about what the children are experiencing to a minimum. Every situation is different, but that would be my general advice. Now, in terms of navigating relationships with doctors and nurses, and I'm going to some degree lump those together because the child really experiences the doctor and nurse as a unit, I think, by and large. But there are several aspects that are important. Clearly, the relationship with the doctors and nurse, with the medical team, is going to involve intimacies that the child is not going to be involved with other healthcare professionals, or for that matter, with other adults. Because it's going to involve physical examinations, it's going to involve history questions or historical questions about topics that the child may not want to talk about, such as wetness, how wet they are, how they've experienced surgeries. They talk about future surgeries. All of these issues are anxiety provoking. Many kids deal with that by turning it all off, which is fine. They don't need to listen if they don't want to. Occasionally you'll have a child who's older, perhaps 8 or 9 or 10, and certainly older than that, who may simply want to leave the room when those topics are described or discussed. And that's fine too. That's the kind of a decision that a child can make if they want to. If there's some important reason for them to be present, well, they can be present for the part that's important for them and then not present otherwise. The other aspect about the intimacy that they will experience with healthcare professionals is the doctors and the nurses the medical team is going to know things about them that no one else is going to know except mom and dad, and obviously the child. So those aspects, in order to have a situation where the doctor and the patient are relatively comfortable with each other, I think it's important that you help the child become comfortable, and for that matter, help the urologist become comfortable in the relationship between the two of them itself. So it's important that the child sees the doctor as an ally. Yeah, the doctor is going to do things sometimes that are embarrassing or uncomfortable or perhaps even painful, hopefully not very painful and hopefully not very long lasting. But those things can be accomplished by someone that you're comfortable with and that you're confident about. And those are the kinds of issues that I think it's really important that the parents help the child to understand. Part of that means that the parent and the urologist and the medical team need to allow the child to talk spontaneously and to encourage spontaneous talk as much as possible. What do I mean by spontaneous talk? That's not answering questions. What children give as answers to questions may relate to what's really going on, or it may not, but you have no way of knowing what the child answers and whether it means anything, because you're not really even sure if the child understands the question. We tend to talk over the heads of children even when we don't think we are. On the other hand, if you can prod the child, push the child even, to provide spontaneous talk about themselves, then you can learn things that can be very important and very valuable, but especially can be important to the relationship between doctor and patient. So it's important for us as the adults to listen, it's important for the medical team to listen, and it's important to gather information from listening to the child and observing the child. That's where we can learn a lot. Asking questions and then listening to the answer, we may learn things about the child, but we aren't really going to be sure what we're learning because we're not really sure what the child is answering. So time spent with the doctor and the patient is important, and I don't mean necessarily alone with the doctor. That may be useful too. Again, this is more suited to given children, some children more than others, maybe more suited to the adults than others. But however it happens, it's important for the child and the doctor to develop a relationship. Obviously, some children can do that more easily than others. Some doctors can do that more easily than others. But I think you'll find that most pediatric urologists are very open to having a good relationship and a confident relationship between them and their patients, their child patients with exstrophy. So in navigating the relationship, you are really helping your child to re-navigate every time they encounter the doctor, and at times that's going to be frequent, especially if it's the first few months after surgery or after a major procedure, for example. And there are times where there's going to be a fair amount of time between visits. I think it's important to somehow connect your child to the doctor even when they aren't seeing them for quite a while, so that they don't forget. When young children forget, young children, like old people, forget easily. Therefore, being reconnected to the doctor in some way can be very useful. So I think ultimately navigating the relationship with adults for children is going to be keying around how the parent helps the child to do the navigating. Sometimes that means the parent's going to have to get involved more in that relationship to make it work right or make it work better. Sometimes the parents can back off and let the child and the adult work that, whether it's a teacher or a doctor, work that out by themselves. Perhaps in the long run, if the child and the adult can work it out together by themselves, there may be more advantage. But those are the kinds of issues that I think are important, and those are the kinds of issues that I would focus on, helping the child to navigate their relationships and have confident relationships with adults. Thank you very much.